Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel and welcome to Monday's Q&A. As many of you already know, this is a place where I answer your direct and specific questions. So if you do have a question that is direct and specific to situation, but is not diagnostic in nature, feel free to email it to me, Natalia, or info@drzphc.com, or you can leave the question below underneath in the comment section, and I'll take it and put it in the Q&A folder. As always, I make sure to block out your names for privacy issues, and I always randomly select 6 questions to go over today and see in what way I can possibly be of help or of any support to you. Another thing that I want to mention, keep in mind that when you post your questions, unfortunately, don't expect that your question will pop up immediately next Monday Q&A, because I do have a folder of questions and I go through them in the orders that I received. So sometimes it might be weeks until you receive the answer. So if you have something that is really, really immediate to you, you can just email me and say, can you do it now and not in Monday Q&A. Having said that, I'm excited for today's list of questions, and let's get going. Question number 1. Thank you for another informative and great video. You are so welcome. I have a question for this series related a bit with dysmorphia, I think you mean versus dysphoria one. This is a very common question, by the way. Dysphoria versus dysmorphia, what's what? For transmasculine people, how can one tell if they're transmasculine or has internalized misogyny? I struggled with this personally myself, thinking I hate to be a woman because of the whole patriarchy shit, and was coping as a radical feminist until I realized I'm actually trans in my 40s. Still, I'm confronted with this question from around. Maybe it has to do something with the teen female to male boom, which I understand seems suspicious. So I'm sure about myself by now and transitioning. I would like to see your point of view. So it sounds like you just want my overall view on how misogyny, transmisogyny may play a role towards dysphoria, because you yourself realized you're trans, you have confronted things about yourself, and you are going through transition, and it seems like you're not questioning it, but perhaps people are asking you that question, or you see that pop up quite a bit. So gender dysphoria is, as I always say, is the psychological byproduct or psychological phenomenon, distress that one experiences as a result of feeling incongruency with their gender assigned at birth. Gender identity is not a mental illness. It's not a pathology. However, the distress that one experiences out of incongruency with one's gender identity is a psychological distress, right? So it's important to realize that gender dysphoria as a psychological stress can arise out of a root cause of incongruency with gender identity. One can also experience gender dysphoria arising out of other root causes and may have nothing to do with one's gender identity. I should really do a video on this topic as well. For example, internalized misogyny is one of the things. Another thing would be history of severe sexual trauma. Another would be secondary severe dural diagnosis. There's numerous things that can come up. This is why it's really important that a clinician knows how to discern and is qualified enough to be able to assess what is the root cause. This is also why right now, as we speak, and this is another thing that's important to just acknowledge, there are an increase of individuals who are going through detransition. One of the reasons why people increase, the studies that I have at least read shows, is not what people often want us to believe. Everybody regrets transition. Actually, the regret rate is still small, but there's a lot of other factors that go into play why people detransition. And apart from just it was so difficult and there's stigma and all of those things, but one of the other factors that people realize that they had something else happening to them that on the surface looked like gender dysphoria related to their gender identity, when in reality, it had nothing to do with their gender identity and it was stemming from something else. Or 2, people realize that their gender identity has evolved. So it's important to keep that in mind, that having gender dysphoria doesn't mean it's exactly arising out of gender identity incongruency. For a lot of people, it is. And then there's individuals where it may, for example, you mentioned body dysmorphia, can be very easily led to confusion that one feels uncomfortable with particular body parts and therefore start going down the path of wondering, oh, maybe that means I'm transgender. And it's also going to depend on so many factors: how insightful the person is, how mature they are in a sense of their intelligence, how developed they are, whether they at the same time had to sit down with somebody who is able to discern those factors, or whether they just assumed for themselves that this equals their trans and jumped into informed consent treatment. So there's a lot of variables. Like I always say, gender dysphoria is incredibly nuanced and complex, and it's not such as black or white as dysphoria equals you're trans and trans equals you must go through gender transition. It's much more nuanced and individualistic. So misogyny, as you say, absolutely plays a role in it. And there's some people who have very deep internalized misogyny, people who have internalized homophobia, people have internalized so many other things that may mask out their relationship to themselves. This is my point of view. Yes, this is possible. And again, this is where assessment plays a part. This is where qualified clinician plays an important part. And this is where, for anybody listening to this, if anybody even thinking, could this be due to misogyny? And do I actually have feelings related to misogyny? And if you do, just sit with it, explore a little bit more. In my experience, a lot of transgender individuals, they can feel, it's almost as if it is viscerally felt, the incongruency, and they can really strongly feel that it's related to their identity, their gender identity versus any other factors. And for some people, it's not like that. So absolutely, oh, I apologize. I should have quit my email so it doesn't make that sound when I get emails. So yeah, absolutely. But that's my point of view. And it's possible. Like I always say, dysphoria is complex phenomenon. It's not so easy to pinpoint, and many factors go into it. But yeah, definitely can experience dysphoria as a result of internalized misogyny. But it may absolutely not mean that you're transgender. But it also may mean that parallel to that, you are trans, and they just happen to coexist together. And that's all there is to it. Great question. Question number 2. Hi, Dr. Z. I'm currently going through a divorce at 42 and living alone. I'm really sorry to hear that. And hopefully this is a good change in your life. I'm supposed to start hormones possibly next week, yet I still feel like I have moments where I have doubts about my gender identity. I thought I was trans female, but I find myself still using one of my coping mechanisms and feeling disappointed afterwards. So not as bad as it used to be, but now questioning if I really am trans or not directly after. Okay, I'm not sure what your coping is, but you're coping, perhaps even avoiding. I have been centering myself with the question, if I took a pill, how would I like to wake up? And the answer is still female. But I sometimes wonder if I'm just headed in the wrong path, and it's just because I don't want to have lost the love of my life for no reason. Oh, I'm so sorry. I'm very confused. At times, I can't look at a female without wishing I look like them, and other times I question if I really dislike being a man, considering I don't feel discomfort toward my masculinity. I don't feel I have ever been diagnosed with my body. I've always just wished I looked like a woman. Please advise. You're indicating a lot of confusion. You're indicating a lot of going back and forth. You're indicating a lot of starting to sit with maybe feeling of regret, fear of loss, catastrophizing out of the experience that happened in your relationship. I don't know if your divorce happened because you came out. If it did happen because you came out, I can imagine how one would then catastrophize that in the future everybody will leave you because you are who you are. So there's a lot of fears here on the table. There's a lot of confusion. There's a lot of concerns going back and forth. And you said you've never seen a therapist. What I would recommend when I get an individual that expressing to me what you're experiencing, I always recommend to engage in therapy. Either a therapist in your local area, even if they're not a gender therapist, somebody that you can talk to, somebody that you can say out loud all of these ideas and get them outside of your head and process them and talk about all of those things. Because our headspace is an interesting space to an extent where we are capable of really believing ourselves, so convincing ourselves of things, or to the extent of making up justification, making up reasons. So if your feelings, your heart is hesitating, right? Your heart is telling you, and maybe your heart is just hesitating because it's telling you, hey, you should maybe need to work out on your fears first. And it may not necessarily telling you that you're not trans, but just that, hey, you're still fearful. Maybe the best is just to address all of these fears first. So then you feel a little bit more grounded and more comfortable moving forward. So I definitely would recommend for you to engage with a therapist if you can. Especially today, there's so many therapists who provide therapy only online. I do it myself. So it's actually quite accessible in that way. And if you have one in your area, I would highly recommend it. Just explore those things, find out what they're telling you. People, when it comes to hormones, have two different types of fears. And I wrote about it quite a bit. One of the most common fears people have is, I'm afraid of the consequences. So this fear has less to do with questioning their gender identity and more afraid how things are going to kind of unfold if they go forward. It has more to do with the external reality and how it's going to unfold. And the second fear that I always caution people to sit with is the one, if I do this, am I going to regret it? What if I turn out to be not trans? What if I'm not sure? What if I'm still confused? This is the fear, in my experience, that tells us, sit with it, explore it a little bit more. Again, it may, after sitting with it, may tell you that it was just your fears that clouded your judgment, but it could be something else. And I think you owe this to yourself. I think all of us owe it to ourselves when it comes to something as life-altering as gender transition. So that's what I would recommend, and hopefully that helps. And I wish you all the best. Question number 3. Also, I do watch your Q&A series videos, and I would really like to know more about practical, successful, sustainable ways to come out at work. Great question. I have been hesitant to reach out because it seems like I should be able to do this. I've come out to family members, and I had been terrified about let me restart the sentence. I've come out to family members that I had been terrified would write me off, and they didn't. Good. I'm glad. I came out to my partner first and without much hesitation at all, but there are a lot of people at my work, many who I think I would be friends with if I wasn't so good at self-isolation. I know I'm afraid, worried about social backlash and stigma. It makes me cringe whenever friendly people I know greet me by the names they don't know is that. I know I need this next step, but like you said in your book, I guess I need a push. You do. We all do need a push, myself included, in my personal affairs and my life. And I needed a push to even write that book. So believe me, we all do need it. I just don't know to move forward. Being a workaholic has been a coping mechanism for me, and that's never been more painfully clear. I'm afraid to compromise but I've started testosterone, and it's becoming even more pressing. A feeling that I need to take the next step. What a great question. Okay, so you're already out to your family, you're already out to your partner, you're probably out to your very close friends, and you have their support. They have your back. If you were my client and you told me all of this, I would say, hey, looks like the most important people you want on your side are already on your side. Looks like you already have one huge, huge win behind you. Then I would tell you this. The longer you wait to come out at work, the longer you keep yourself, the more you catastrophizes the outcome. The more you catastrophize, the more you ruminate, the bigger that fear gets. And before you know it, you have blown it out to such a proportion, and you fear coming at work to such an extent that it terrifies you in your tracks. So don't do that to yourself. Now, you ask for practical, successful, sustainable ways to come out at work, and I'm going to tell you my practical, sustainable, and successful for a lot of people way of coming out at work. First, do you work for a big company? Do you work for a big organization, or do you work for a small organization? The first step is always go to HR. Every company should have an HR. So the first is to go to HR and privately tell HR that this is what's happening in my life, this is who I am. and ask HR if they had somebody in the work environment that had similar experience. So in other words, you're trying to vet HR if they know how to navigate this. If HR says, I know exactly, we've done this before, don't worry, this is what we suggest, great. If HR says, I never done this before and I have no idea how to proceed, don't be scared. That's actually a good thing, because now you have a control of your story and how to navigate it. In that case, what I recommend is, again, depending on a company, you may work for a really huge company and coming out to everybody may not even be warranted. You may just need to come out to very close circle of teammates. In other words, people who interact with you on a daily basis. The best way I have found for my clients to come out at work is simple, to the point email that they can blast out to anybody connected to you with whom you interact. And I recommend email to be very, very simple. None of the details, none of the personal things, because it's nobody's business. And the only reason why you're coming out at work is because right now you're starting taking testosterone. You already know you're having changes. You're going to have more changes. So the only reason you're coming out is because you want to inform people. So that way, one, when they see the changes, they're not coming up to your desk and saying, what the hell is going on? Is everything okay? I see you're changing. So they're not really putting their nose into your business. And two, they finally can start addressing you by your rightful name. So email, super short, hi team, or it can be from you or from HR, letting you all know so is going through gender transition and identifies as / their preferred pronouns / and they will be going by / name. That's it. Very easy, very to the point, not much information. People who are going to be closest to you at your work, who are going to see that email, who you already have close relationship, will then make extra steps to come up to you and then maybe inquire, because they know you on a personal level, and say, hey, this is, people say numerous things. Hey, this is great. I had no idea. People say all kind of, I don't know, sometimes it's nonsensical bullshit, which mostly more about them than has anything to do with you. So keep it short, keep it to the point. This is my recommendation. HR first, then email, just let it out there and continue your work as always. And remember, you already have the support of the closest people to you. Usually people feel that they're scared to come out to their loved ones first, but not so scared to come out at work. Now, one little thing, depending where you are in the United States, and if you're terrified of coming out at work because you're afraid you're going to be laid off or fired or discriminated against your gender identity, that's a different story. I still recommend going through HR, because then you're doing it through all the corporate channels that they like doing it, and at least you have all of that documented, that will work in your favor. But definitely HR is the way to go. And if anybody came out at work and they want to chime in and share their feedback down below, please do so. I think you're going to be fine. I get a feeling that a lot of times we rally up fear. And when we finally do whatever it is we're scared to do, we realize that we wasted all our time being afraid. Don't be afraid. You already took the biggest step. You already have the biggest support of your family and your friends. And really, that's all you need. And I think you'll be surprised how many people at work will support you. And then you'll come out of your isolation and hang out with them more. So I wish you all the best. Great, great question. Question number 4. Question: my elderly parents, 70, are reasonably accepting of my transition. They have not tried to talk me out of, and they have no problem being seen with me in public, while I wear women's clothing and having visible breasts. The problem is that I can't get them to stop using my dead name and male pronouns. They say that it's a 50-year-old habit that's hard for them to break, and to them it seems harmless. I have tried to be patient, but it is getting harder and harder for me to deal with the misgendering. Any suggestions on how to approach the issue without making them feel bad for sticking with old habits? So I have a video on misgendering and how to deal with misgendering. I do say that I consider an exception to the rule when you do have people in your life who are like, you have like 80, 90-year-old grandma that really, could even have memory issues. But or maybe not, and just really struggling with it. This is a different case. 70 is not that old. My husband is 60. 10 years from today, I can't imagine him suddenly not being able to change some of his habits. So 70 is actually, not old by today's standard. But the case in your situation is that your parents socialize with you out in public, right? And that makes it that much more unbearable, because now when you're out in public, every time they dead name you or every time they misgender you, now they're outing you to the world constantly, again and again and again. And that's painful, that's hard, that's uncomfortable, that's just not a way to go. So what I would do if I was in your shoes, and I know that you're afraid of making them feel bad for sticking with old habits, but they need to also realize that while they have a hard time breaking their habits, their habituated behavior is doing you more harm. So the way I would approach it is sit down with them and explain that, hey, it's one thing if this was maybe happening occasionally and privacy of home, and I get it, you guys are trying, but we're going out in public and we're eating out in a restaurant and you dead name me and you misgender me, and when that happens again and again, that's traumatizing for me, that's hard for me, that's painful for me. And use whatever words, whatever you actually feel at that moment. I'm just making it up as I go. Whatever you may feel at that moment, and express to them how you feel. Connect with them on the feeling level. When you connect on a feeling level, it's hard for people to say, oh, it's just a habit, it's so hard for me, because they now realize that, yeah, it's just a habit, it's hard for them, but their habit is causing you a lot of harm and a lot of pain, and they have to be more mindful of their habits. So I always encourage people in this type of situations to connect on the feeling level, to really explain what happens. Not just that, oh, you misgender me and or you dead name me and that's no longer my name, right? More that you need to realize when we're out, you're outing me to the world constantly. And it also puts me in safety risk, especially right now with anti-trans stuff going on. So that's what I would do in your situation. I would connect with them on that level. I wouldn't feel bad about, you're not making them bad for sticking to their habits. I don't think you're making them bad, feeling bad. You opening up, broadening up their eyes to the way their behavior is impacting you. And that's really important. So I wish you all the best. And I hope that they will be more receptive to you and to your needs, because that's when they do it in public, that's and old habits, in my opinion, is not an excuse, and we should all try harder. It is possible to socialize in public without even gendering a person, without even using pronouns, without even using a name. It is possible. We all try, we all do, and they can too. So I wish you all the best. Question number 5. Hello, Dr. Z. I'm 42 years old, transgender woman in the closet. At the moment, I live as a male, and I am married with 2 daughters. I have recently started hormone therapy through an informed consent clinic, but I have not told my family. I do not want to disrupt my girls' lives with my problem. I love them. They're a blessing in my life. Long ago, I decided to not do anything about my gender dysphoria until they had grown and left our home. That was my plan. However, I feel that my hope of someday dealing with this has evaporated. I feel like the world is closing in on me and I feel depressed. I feel trapped. What can I do? My heart goes out to you. It is a very, very tough situation. I don't know how old your 2 daughters are. You're 42. I have no idea how old they are. I mean, they could be 5 years old, could be 15 years old. And you started hormones. And I also don't know if you're in a relationship. I don't see in here whether you're in a relationship with the parent of the girls, and if that person knows. A lot of you who watch my content knows that I have my own opinions about when people in a relationship already conscious about their gender identity but not open to their partners. This is, again, my opinion. I'm a woman of very, very strong opinions, if you haven't realized. And my opinions are not for everybody. And remember, opinions are just that, they're opinions. In my view, if you are right now in a relationship and your partner doesn't know, and you're already on hormones, if I were working with you, that would be the first focus, because I would be telling you that I would be encouraging you to put yourself in their shoes and imagine how betrayed and perhaps even lied to they feel. So that would be my first inclination. Now, let's imagine the second hypothetical. Let's imagine that you haven't mentioned partner, and in your story, it's maybe you're separated or whatnot, or maybe there is no partner and you have these two girls, right? But you're not out to girls. Does that situation then change? And it does change, in my view, because the girls have not made a marital or relationship commitment to you based on perception of one gender identity, right? So it does change to the fact that, yeah, you can absolutely keep it to yourself, and not let them know if you don't feel like they're ready or they're comfortable or for whatever. People keep that from their kids for numerous reasons, and reasons are personal, and everybody has valid reasons. What I encourage for you to think about is how much tension you're expressing to me in this comment. You're expressing tremendous amount of tension between starting hormones and probably, I would assume, feeling some form of comfort as a result of starting hormones that indicated to you that there's hope, that indicated to you there's something out there. And then at the same time, you're really torn that this may never happen because you have made a commitment to yourself that you're not going to do it until the girls are, grown and left. Oh, you said left our home. So you are with a partner and left our home. That's a personal decision. As a psychologist, I will tell you this. I have seen how parents who are not out to their kids, while still being tremendously amazing parents, and in no way interrupts you from being a great parent, but there's something missing in the connectivity with the kids. And I've seen people be so much more present and so much more themselves and so many other things when they are with their kids and when the kids know. I just seen it. And I think a lot of parents who are watching this who can attest to that their relationship with their kids have changed for good once they were out and were themselves, because dysphoria causes so many things. One of them is dissociation. One of them is withdrawal and not being really present with people around you in your life. And while you may think you're coping, perhaps sometimes when you spend time with your daughters, they feel like you're not really fully present and they can't put their finger on why. So that's my only thing psychologically for you to ponder. But this is a tough decision. What do you do? What can you do? You can do lots of things. You can be honest with yourself. You can be honest with your partner if you're not already. You can be honest with your girls. You can also engage in therapy in your area and see how to approach this topic, how to best come out to your girls. You can also not come out to your girls, and you can continue to cope and continue to experience this tension. And that's also a painful way to go. There's lots of options here. It's not my job to judge which option you take and whether it's a good or bad option. My job is to present with you with all these avenues, including how psychologically it's affecting you. And I wish you all the best. Tough situation. A lot of people, you're not alone. A lot of people feel tremendous amount of guilt over their kids, feel like they're responsible now, feel like they're going to ruin their kids' life as they come out. And, I don't see that. And when I do see that, that's very unfortunate when it happens that the kids, usually I see that when the kids are really much older and they have their own now ideas and values about the gender and identities. But with younger kids, I never ever see that. Usually I see young kids being very, very supportive. So wish you all the best. And I hope that other people will share with you some of the feedback and how they handled it. Final question for today, question number 6. First off, I just wanted to say thank you for the content you produce. You are so, so welcome. And your new book, thank you. By the way, this is the second person mentioning my book today. I forgot to also mention that anybody watching, if you cannot afford my book, can't afford the digital, or you can't afford the print copy, you can just email me. I can give you a free PDF of the book. I don't want people to not have access to the resource, because I do feel that the book is very encouraging and very empowering and incredibly supportive, especially right now. So I want people to have that information. I found several passages really helpful for me. I'm so glad, so glad. My job's done well. Now on the question, do you have any exercises, practices to help with dissociation and reflective emotional repression? Excellent question. For some contexts, I've been working with my therapist on accepting myself and deciding which steps are right for me. But I still have a lot of trouble actually feeling my emotions. I can logically connect the dots that, yes, I'm trans, but almost anytime I have a moment of joy from experiencing with my presentation, longing to be in a different body, or even jealousy when I see a woman in a cute outfit walk past, it's like a wall immediately goes up and I'm disconnected from myself again. Like I'm back in the pilot's chair, just driving my body around. And it's hard to get back into a place where I can feel these emotions again. So any kind of exercises you might have would be helpful. Thanks again for all you do. So this is a great question, because dissociation is so incredibly common in trans individuals. And one of the reasons why it's common is because it's so hard to exist in this body vessel. In a world that genders the body vessel. So as a result, your psyche will want to dissociate, it will want to leave, it will want to create a barrier. And one of the ways to create a barrier is to dissociate. Now, I also do notice that you're not completely absent and not in touch with your emotions, because you do feel the things, like you said, you moments from joy, that's an emotion, joy, even jealousy, that's a feeling. So I want you to notice that sometimes when we get so disconnected from ourselves, we then have a difficult time realizing what that language actually means, realizing that, hey, joy is an emotional expression. I am feeling an emotion, right? Now, it may be fleeting for you, which in your case you're describing, because then the wall goes up and you start dissociating, but it's there nonetheless. So anytime you experience those things, journal on them, write them down, work on them. Also try to perhaps work on emotional vocabulary in order to understand how those things feel, when do those things arise. Dissociation can be challenging, I won't lie, depending on the longer the person has been using dissociation as defense, the harder it is to break the dissociation down. What I recommend first and foremost is grounding. Very, very important grounding exercises. They could be sitting down on something concrete and really feeling the floor with your feet, the way I'm doing right now, and none of you can see it, feeling the texture of the tables that you're sitting on, feeling the texture of the clothes. Grounding exercises that ground your physicality in this world. Breathing. 4 deep breaths in, 4 deep breaths out, 4 deep breaths in, 4 deep breaths out. Centering yourself are really, really good and important. So, and there's basically many other grounding exercises, including yoga as well. So I recommend anytime that you have an opportunity to also just to connect to your body. Maybe when you're taking a shower, just try to connect. What is mindfulness, right? So try to connect. What does it feel like to have water run on your face? What does it feel to have water run down your body? When you lie in bed, what does it feel like to touch yourself? What do your arms feel like? That's mindfulness. That's basically being mindful and aware of what is, without judging it, without naming it, with just feeling it. That's what I really recommend. But any kind of grounding exercises would be really, really phenomenal. And if you Google, you probably will come up with a whole bunch of grounding exercises apart from what I just named. And that would be the first step. Dissociation gets better once a person starts to get more in alignment with who they are, whether or not they go through gender transition. And an alignment can happen through the transition, but can also happen through just owning who you are and expressing who you are and starting to show up in the world who you are through numerous ways. And when you do that, you start feeling more concrete. Your psyche doesn't want to withdraw from the body. Now it wants to reside in the body because now it feels one with the body. And so dissociation tends to tends to decrease. So that's what I would recommend. Great question. I'm glad you're also working with your therapist. Your therapist can also help you absolutely with the grounding exercises. So great questions for today. Thank you everybody so much. Comment below. I always love reading all of your comments. And if you have a question, you can email it to me or you can comment below and I'll snatch it up. And yeah, that's it. Other than that, I will see you all next time. Bye.